but certainly the reopenings in those countries have led to more intense transmission. Now a number of countries face a scenario in which there's increasing and sometimes exponential transmission, a very difficult situation to face, and not necessarily with the option to impose these so-called lockdowns again because of the economic damage and the community acceptance of those. But as Tedros said, there is no situation which cannot be faced, and I think this is the issue, is to turn and face the fire, turn and face the problem, and accept that it's going to take time. It's going to require a huge commitment on the part of government and individuals in a number of countries to turn this around. And it's not just government, it's individuals, the choices we make. I think I spoke about that last week. There are choices that we all make that can either increase or decrease the risk of transmission. But there are choices that governments make that can either increase or decrease the risk of transmission. We need to re-establish trust, communication, and strong government-led strategies that can turn this around. Some of that may require limited or geographically focused lockdowns that suppress transmission in specific areas and where transmission is frankly out of control. But that is not the case in all places. All countries in the Americas have areas in their countries in which transmission is at a reasonably low level. But some areas in almost all countries have areas of intense transmission. And in those situations, absolute individual and community adherence to social distancing, hygiene, the wearing of masks when appropriate, all of those different things. If everybody does that, then we will suppress transmission, avoiding crowded places. But if people continue to frequent crowded places without taking the necessary precautions, if people aren't practicing physical distancing, if people aren't practicing hygiene, if people aren't wearing masks in the proper settings, then the disease will continue to transmit. At the same time, governments have to support communities in that, and governments have to be, again, Tedros spoke to it very clearly, we need to be absolutely clear and consistent in our messaging to our citizens. And it's got to be easy for citizens to comply. It's got to be facilitated, and it's got to be supported. So, and within all of that, as we get control back of the disease, and I can't say this strongly enough, the countries that have put in place strong public health surveillance architecture while they've been dealing with their lockdowns are now emerging from those lockdowns in a stepwise fashion, and they're replacing lockdowns with strong public health capacity to detect, to test, to quarantine and to treat cases. And countries that have taken that path are having relative success in continuing to suppress the virus. But as I've said here before, we need to learn to live with this virus. Expecting that we will eradicate or eliminate this virus in the coming months is not realistic. And also believing that magically we will get a perfect vaccine that everyone will have access to is also not realistic. The history of vaccines are that we can and will develop a vaccine. The question mark is how effective will that vaccine be? And more importantly and more worryingly, who will get that vaccine? And will that distribution be fair and equitable? But as Tedros has said, there are things we can do now. There are tools we have at our disposal now. If we apply them, and if we apply them systematically, and if communities and individuals buy into that and trust that their behaviour will be supported by government, and we can work together collectively to drive down and suppress transmission. The positive news in this is that in many countries death rates have fallen, and we are getting better at treating cases, we're getting better at diagnosing cases early, and we need to continue that. We need to suppress mortality, suppress transmission, we need to support communities, and we need clear and strong government leadership. And that doesn't matter where you are, but that's all the more important in countries that are now suffering very, very exponential transmission, which is very, very worrying.
Thanks, Mike. I want to speak to the individual. So as Mike has said, it's not only about leadership, it's about individuals and what individuals do. And everyone on the planet needs to know what role they have to play and to be informed about what this virus is, where this virus is circulating, especially in the areas where you live, the areas where you work, the areas that you want to travel in. All of this is important. There's so much that you can do yourself to protect yourself from getting infected and to prevent yourself from passing the virus on to others. And please make good choices. I know that there are a lot of things that we want to be doing right now, but there aren't necessarily a lot of things that we need to be doing right now. There are many people, essential workers, who cannot stay at home. There are many people who are caring for patients in hospitals who cannot stay at home. And if you can, and if you can help, and if you are asked to, please stay home. You can practice physical distancing from others. You can avoid crowded places. You can avoid places that have enclosed settings that have poor ventilation. You can clean your hands. You can practice respiratory etiquette. You can wear a mask if you cannot do physical distancing. There are so many things that you could be doing, talking to your children, explaining to them the risks. Everyone has a role to play. And this is far from over. So we all have to play our part.
Thank you very much, Drs. Ryan and Van Kemp.